Well, Minister Paradis, our distinguished guests, ladies and gentlemen, my name is Khalil Sharif. I'm the Chief Executive Officer of Aga Khan Foundation Canada, and it is a great delight to welcome you to the delegation of the Ismaili Imamate for today's session on polio eradication. When the delegation was opened in 2008 by the Aga Khan and Prime Minister Harper, they expressed at that time a joint aspiration that this building might be used to bring together those conversations that lift our horizon about Canada's role in the world and how we might contribute to a more peaceful, prosperous, and pluralist world together. And it's been a great delight since that time for us to be able to convene intelligent, thoughtful conversations about exactly those issues. This event here is part of a series of sessions on maternal, newborn, and child health, which we've been convening for the last several months on a number of issues, from nutrition to e-health to innovative finance in health to health human resources. But today, we are really fortunate to be with the Canadian MNCH Network. Helen Scott is here, co-hosting this session, our most recent in the seminar series on polio eradication. This is an issue on which, of course, Canada has been a massive leader. And when I say Canada, I don't mean only the government of Canada, although definitely the government of Canada, but also Canadians. And we've got Rotary here as a great expression of the commitment that Canadian civil society has shown on this issue, which has been truly inspiring. Of course, it's also an issue on which the Aga Khan Development Network has had a major focus. The Aga Khan University in Pakistan has been a major leader of the research effort in Pakistan, especially on this issue, and we're really quite pleased that the university, which was established in some senses 3 or 4 decades ago, exactly because we felt there needed to be strong, world-class institutions in the developing world, researching developing world issues, is now taking on that leadership role on such a central issue for that region as polio. So today we're going to hear brief remarks from some of the most important experts in the field, and then you're going to have an opportunity to interact with them more informally during the reception. But to kick us off, I am really delighted to welcome Minister Christian Paradis, the Minister for International Development, who's here on a tight timeline, so we're very, very pleased that you've made some time to join us. Ladies and gentlemen, please welcome for opening remarks, Minister Paradis.
Merci beaucoup, Khalil, and thank you very much. Good evening, everyone. And je crois que Madame Laverdière était ici, ma collègue de Laurier-Sainte-Marie. And I see my colleague here, Ron Cannon from Kelowna Lake Country, who is highly involved in Rotarians. And it's a good involvement, so I'm glad to see you here, Ron, today. I apologize not being able to staff to go back in the House of Commons for a vote in a few minutes, so I will have to make it fast. But it's important, once again, to be here and just celebrate what we're doing and continue. And my thanks to the Aga Khan Foundation Canada for hosting this reception, and to UNICEF for the great photo exhibit of Canadian-funded polio eradication efforts in Afghanistan and Pakistan. C'est merveilleux de voir le travail qui est accompli, et je crois que nous pouvons tous comprendre d'une façon ou d'une autre la menace que pose la poliomyélinite. Que nous soyons parents ou que nous fassions partie de ceux qui se rappellent tous les jours où la menace de cette maladie meurtrière planait sur nous aussi au Canada, et il y a quelques décennies seulement. Donc, il y a longtemps que la menace ne pèse plus, mais elle est dans d'autres pays. Et tous les enfants, où qu'ils soient, ont le droit de pouvoir envisager l'avenir avec espoir et optimisme. Et c'est d'ailleurs ce qui motive l'effort mondial visant à éradiquer la polio une fois pour toutes. Our government is committed to eradicating polio around the world, and to do so, we must work together. We must buy polio vaccines and deliver them to the children in outbreak areas. And we must raise awareness and community acceptance of the usefulness of the vaccine. This can be done by integrating immunization directly into national health systems. Most importantly, we must finish the job as quickly as possible. Through Canada's Muskoka initiative, we are helping reach every last child. And that is one of the many reasons why Prime Minister Harper is hosting the Maternal, Newborn and Child Health Summit this spring. And maternal and child health is Canada's leading development priority, as you all know. Before the PM Harper drew the world's attention to this crucial issue, we were falling short on reducing child mortality and curbing maternal death. Thanks to the Muskoka Initiative and subsequent global action, maternal mortality rates are declining, and millions of more children are celebrating their 5th birthday. Our common goal has not yet been reached, but it is within arm's reach. Together, we can eliminate preventable deaths among women, children, and newborns, and we can save millions of lives that hang in the balance. Canada is proud to be part of the global effort to end polio, and we are making great progress around the world with our partners, and I was impressed to see the stats that I was just shown before the meeting by the WHO, UNICEF, and the Rotarians. We are on a good track, but we have to continue. And as you know, polio cases have decreased by more than 99% over the past 2 decades, and today the disease remains endemic in Afghanistan, Pakistan, and Nigeria. And even there, the numbers are at an all-time low. The end of this terrible disease is in sight. And Canada applauds all of those who have helped the world come this far, and in particular, I want to acknowledge the extraordinary partnership between Canada and Rotary International, WHO, and UNICEF. Tous ces acteurs ont joué un rôle de premier plan dans l'éradication de la polio, et en 1988, le Canada a été le premier pays à contribuer à l'initiative mondiale pour l'éradication de la poliomyélinite. Tout au long des 25 années qui se sont écoulées depuis, il a offert un généreux soutien. En Afghanistan, le Canada est en tête des donateurs qui contribuent à l'éradication de la polio, et notre appui a aidé à vacciner plus de 12 millions d'enfants dans ce pays. Lors du sommet mondial sur les vaccins, le Canada s'est aussi engagé à consacrer 250 millions de dollars sur 6 ans à la lutte pour l'éradication de la polio. Et dans la dernière année, il a versé plus de 100 millions de dollars à cette fin. Et cela dit, nous n'avons pas le loisir de reposer sur nos lauriers, comme je disais. Surtout que nous sommes si près du but. Nous devons enrayer la poliomyélite à tout jamais. Au Pakistan, le nombre de cas s'est accru et de nouveaux foyers d'infection ont été constatés dans la Corne de l'Afrique, au Cameroun, en Guinée équatoriale et en Syrie. Ce sont là les plus importants obstacles à l'éradication et c'est pourquoi je suis heureux d'annoncer aujourd'hui que le Canada consacrera une somme supplémentaire de 2 millions de dollars à la lutte contre la poliomyélite en Afrique de l'Est et dans la Corne de l'Afrique. Cette somme permettra à l'Organisation mondiale de la santé d'améliorer la surveillance et l'accès à l'immunisation. Le Canada consent également 1 million de dollars afin d'aider l'UNICEF à combattre la poliomyélite en Somalie. Le projet de cette organisation contribuera à l'achat des vaccins qui seront administrés aux enfants dans les régions touchées. Tant qu'il y aura des cas de polio dans le monde, la population tout entière devra être immunisée, d'où la nécessité de distribuer chaque année des centaines de millions de doses de vaccins pour venir à bout de cette maladie. As long as there are cases of polio on the planet, the entire population needs to be immunized. And that means providing hundreds of millions of vaccine doses every year until the eradication is achieved. And that is why today I'm proud to announce Canada is committing an additional $2 million to fight polio in East Africa and the Horn of Africa. This will be used by WHO to increase surveillance and access to immunization. In addition, Canada is contributing $1 million to help UNICEF fight polio in Somalia. This project will help buy polio vaccines and deliver it to children in outbreak areas. And despite being so close to a historic end to the disease, the challenges that remains are not easy. The majority of polio cases are in remote and difficult reach area. And polio eradication workers continue to face incredible danger as they risk their lives to keep children from contracting the disease. Vaccines are among the most cost-effective investment in global health, saving about 2.5 million lives each year. But the fact remains that a child dies from a vaccine-preventable disease every 20 seconds. This is a big challenge, but I cannot imagine better partners to have at our side as we tackle it. I congratulate you all on your remarkable progress to date. We continue to count on you to do all that can be done to reach the goal of polio eradication, and you can continue to count on our government as a strong partner going forward. We will continue to focus on helping families, creating jobs, keeping our economy strong, and we'll continue to meet global challenges head-on like we did through the Economic Action Plan during the global economic crisis. And today, Canada has the strongest job record in the developed world, and we've created almost 1.1 million jobs since the recession. An impressive feat, and one that we can export around the world, and we're making the investments to protect Canadians and create new jobs while laying the foundation for future growth. Prime Minister Harper has demonstrated his leadership and judgment through challenging economic times, and he has demonstrated his leadership on the global stage through his focus on maternal and child health, and he will continue to lead going forward to ensure Canadian priorities are at the heart of the post-2015 development agenda. Thank you very much, and sorry now I have to leave like a fugitive, but I'd like to spend more time with you. Thank you very much.
Well, thank you, Minister, and I know there are a couple of other members of Parliament with us who will now be discharged to go and exercise the duties of their office in the House, but thank you for being here, even if briefly. So, friends, this is how we're going to proceed. We've got three extraordinary speakers who are going to give you, in rapid-fire succession, nuggets of wisdom and insight, concentrated with great pith on this issue. And they will, and after they're done, we're going to station them in three spots, and they're going to be forbidden to move. And you will have the opportunity to engage each of them in a conversation on the issues that they are going to be putting on the table now, especially that have to do with Canada's role on the great issue of polio eradication in relation especially to these hard-to-reach areas that the world is still struggling with. So the three people you're about to hear from are Dr. Bruce Aylward, who is the Assistant Director General for Polio Emergencies and Country Collaboration at the World Health Organization. The bios, by the way, are on your seats. Will Wilkinson, who is Rotary's National Advocacy Advisor in Canada, and David Morley, who is the President and CEO of UNICEF Canada. So what I'm going to do now is ask Bruce to come up first, followed immediately by Wilf, followed immediately by David, and then David's going to take you through the next part of the program. So ladies and gentlemen, please welcome Dr. Bruce Aylward. Bruce, great to have you here.
I was absolutely delighted that Khalil introduced me by saying that I was going to get up here and talk with great pith, because I don't have a clue what pith is. Coming from Newfoundland as I do, we don't use big words like pith. So I can talk about whatever I feel like, and that's all I understood from that. So thank you very much, Khalil, for hosting us and for the foundation, giving us this wonderful space to be able to talk about a wonderful program. One of the other things Khalil said earlier in his opening comments, though, in all seriousness, was that this wonderful space and this wonderful place is designed in part to try and lift our horizons, and there's no better place to talk a little bit about polio eradication, because this is one of those very, very rare programs that allow us to really lift our horizons and really dream, because as most of you know, this program is about a permanent solution to an absolutely awful problem, and that is the problem of polio. This is a disease which we've long forgotten almost in this country. I mean, I think actually the last case in Canada, the Indigenous case, actually occurred the year I was born, so I'm going to leave you to figure that one out. But what? It was 5 years ago. Yeah. No, it was a little longer than that. But we've begun to forget this disease in this country, and this is an awful, debilitating, devastating, painful disease, and it's a disease that maimed hundreds of thousands of children around the world, 500,000 children probably. We say 350,000 a year before we started, but it was probably even more than that, and left these children paralyzed for life. Big impact on their lives, terrible impact on their lives, on their families, and often on their communities. So polio eradication, it's one of these rare initiatives that allows you to dream a little bit about a world that is more just, a little bit more just, a little bit more equitable, because every child would be protected in perpetuity from this disease when we are successful. So a huge initiative. And 1 year ago, we set out, it was 1 year ago this month, we launched one of the most ambitious programs, or one of the most ambitious plans and timelines in international public health, and that was the polio endgame. It was about how we were going to bring together all the different problems, all the different challenges, but all the things we had learned, and try and put that together for a big push over the next 6 years to get this finished once and for all. And right now, we're traveling around to some of the big countries, big partner countries, to talk about where we are 1 year into this program. And I'm delighted that we're starting in Canada, because Canada has played a very, very special role in this. It's completely appropriate that we start here, because Canada was really there right at the beginning of this initiative, as I'm sure Rotary will probably speak to, because it was in part due to their advocacy. Canada was one of the first government donors into this initiative. And last year in Abu Dhabi, when we kicked off this new plan, Canada was the first government to stand up and announce a $250 million pledge to this initiative. So I think that's one reason it's important, because Canada's played such an important role in the program. But the other thing is, this program speaks so much to some of the values that Canada holds so close, and those are multilateralism, rather, culturalism as well, but lateralism, but also partnership. This is very much not about WHO, not about UNICEF or Rotary, but a partnership that really pulls together to try and achieve something extraordinary. It's also, as I mentioned, about equity and social justice, a lot of values that Canadians hold very, very dear. So 1 year into this, where are we? When we began, if we take a step back, 1988, everyone's face drops. Oh my God, we're going to start in 1988 and go forward every year. No, we're going to jump forward real quick. But if we go back 1988, 1,000 children were paralyzed every single day, probably even more than that, at a minimum, 1,000 every single day, by a disease that we had an incredibly effective vaccine for more than 20, 30 years at that point. That was a travesty. It was an incredible injustice that kids were still being paralyzed by that. Most people could live with that. Rotary couldn't, and Rotary were actually the ones that stood up and said, we need to do something about this, joined with UNICEF, joined with World Health Organization, joined with Canada and so many Canadian institutions to try and do something about it. So back then, 1988, I was going to do the math in my head, but then you'd all know I'm from Newfoundland, so I'm not going to do that. Way back then, we had 1,000 kids a day. Today, there's less than a kid every 2-3 days being paralyzed by this disease. Huge progress, but still not enough. So 1 year into this endgame plan, where are we? First, some really big news. It's a real mistake that the minister leaves just when you're going to tell him this is a bang for your buck. But I think we're all delighted to know that our politicians are actually working in the evenings. This is great. I want photographic evidence of that. So someone should have followed him. Just joking. God, you turn that off. But, you know, the great news, and you can all tell the minister, the great news is 1 year into this, we are down one virus. Polio is actually caused by 3 different viruses. One of them was knocked out about 15 years ago now. But the second type of polio, when we started this endgame, there were 2 types left, 2. And now it's nearly 12 months, longer than 12 months, since we've seen one of those 2 types. So we may have knocked off already 1 year into this, one more cause of permanent paralysis in the world. The second huge piece of progress is in Nigeria, a country which 2 years ago, or a year ago even, the world was saying that's the reason this initiative is going to fail. They're never going to reach all the kids in the northern part of Nigeria. Well, so far this year, only 1 child has been paralyzed by the disease, and that was, I think, on the 10th of February, if I remember correctly, Bob. 1st of February, Bob says. But anyway, some time back, but a huge drop in cases in one of the countries that were the greatest challenge to getting it finished. If we look at the other 2 countries where we've never stopped polio, in Afghanistan, over the last 18 months, only 1 child has been paralyzed by the virus that's endemic to that country. These are huge achievements that we didn't dream of even 12, well, we did dream of. That was the idea for the endgame, but we didn't dream to see that kind of progress so quickly. The other big things we've seen is new areas that have gotten infected, some of the most challenging places in the world. The virus got into Somalia again last year for the 2nd or 3rd time, exploded. 120 kids were paralyzed in Mogadishu. We've not seen the virus there since December now. So it did get shut down, one of the most difficult areas to operate in the world. You saw the virus got back into Syria. It was all over the news. We can't operate in Syria. We can't do this. We can't do that. 3 million children are vaccinated each month now in Syria, and we've not seen the virus since just over a month now. It slowed right down, and we believe we're going to get that outbreak stopped as well. The big challenges we face really right now in Pakistan, right on that Afghan-Pakistan border. They were shooting vaccinators, as you all read about in the newspapers and as the minister talked about as recently as earlier this year. And also in another area there, they had banned vaccination for a number of reasons that had everything to do with local politics and how they could leverage this for their own agendas in that area rather than for the health of kids. But in both of those areas, things are turning around. About 2 months ago, the local political leaders in the area where the vaccinators were being killed in Pakistan, they came out and said, we will protect the program, we will establish a new way of working here, and if you shoot at the vaccinators, you are shooting at us. Not one vaccinator has been attacked in that area for 2 months, 3 months now, since they've put in place such a rigid program to protect and ensure that these kids can get the very basics in health services. And in terms of the international spread, the world has stood up and decided enough is enough, and later this month there will be a special emergency committee under the international health regulations that will look at whether or not there should be requirements for vaccination for anyone out of any of these areas to travel. The world is taking very, very seriously its commitment to deliver a polio-free world to the future generations. So there are big challenges, but a lot of very, very positive developments just 1 year into this program. And I'm delighted, Khalil, that you would offer us such a wonderful space where I think it inspires one to dream, a beautiful place like this, and the dream is becoming a reality. It's becoming a reality because of the resolve of a lot of the people in this room. I think we have an opportunity. We have a lot of people from, now I'm not allowed to say CEDA anymore. I have to say the Department of Foreign Affairs, Trade and Development. Did I get it almost right? Yeah, there you go. So congratulations to these people because they're the heroes that actually do the work of making sure Canadian taxpayers' money is put to good purpose and helps save the lives of children around the world. So thank you. But it's also because of a partnership, a very, very robust partnership. I'm with the World Health Organization. I could speak just as easily about the role that UNICEF plays or Rotary plays because we've been working together on this now with the broader Canadian partnership and others for over 20 years. And it is an extremely effective partnership that draws on the strengths of each one of those partners. We do some of the technical work, the surveillance work, stuff like that. UNICEF buys the vaccines, gets them out, mobilizes the communities. Rotary's out there championing this with the political leadership, holding them accountable, all to ensure that the resources of this country that are so generously put to this program make a difference. So tonight, a chance to say congratulations on what's been achieved so far. Thank you very much to Canada in recognition of the tremendous role the country has played in this initiative. Thank you, Khalil, for hosting us and giving us the opportunity to say this. But again, also a chance to remember kids are still being paralyzed. And if they're still being paralyzed, that means we are not getting the most basic services in the world to some of the kids that are in the most vulnerable situations around the world. And that's why finishing this is so important, and that's why maintaining that resolve to see it through is absolutely critical. Thank you very much for a chance to say a few words about it. And Khalil, thank you for hosting us again.
Well, Chairman Khalil and my friends, non, mes chers amis, je regrette beaucoup parce que je ne parle pas la langue française. But I will do my best in English to say how happy I am to be here. I'm a Canadian, and I'm proud of it. I'm a Rotarian, and I'm proud of it. I've been involved with the polio campaign since it started. My job was to be the vice chairman and the treasurer for the money that had to be raised in Canada for our first polio efforts. When the World Health Organization, before Bruce was born, told us that for $150 million, we could eradicate polio. And Canada's objective was set at, I think it was $3 or $4 million. Canada, with the help of the government, who contributed, I think it was $3 million, we raised $11 million. And Rotary around the world raised over $250 million. So we thought in 1988 that this was a done deal. It was promised we would have the world certified polio-free by the year 2005. And that was important to Rotarians because that was our 100th anniversary. The 100th anniversary of the oldest and largest and most international service club in the world. And there are a lot of service clubs in the world. I can't tell you how these years have changed me. I've had an opportunity to put the drops into the mouths of children in Pakistan, on the border with Afghanistan, in India, in Kenya, in Dar es Salaam. Dar es Salaam is the best one. We were concerned. This is going back to 1997 at this point. And we went out to the area that had the worst coverage in the previous NID. And I went with the president of Dar es Salaam, of the country. And here were the television cameras. They were pretty new in 1997. The programs were all there. The president said to me, well, Mr. Williamson, you put in the first drop. So I went forward, and somebody handed me the file, and this lady was sitting there. The baby was screaming their head off. I got there, and I squeezed, and I squeezed. Nothing was happening. Then somebody noticed that no one had taken the top off the vial. I was found that even though the thing that even an accountant, which I am, when the top was moved off the vial, even it's easy to put drops in the mouths of those children. We're fortunate that Rotary was able to find the partners like the World Health Organization, like UNICEF, like the Center for Disease Control, and more recently, the Bill and Melinda Gates Foundation. They have brought this program together. As I said earlier today, this is, I believe, the largest public-private healthcare initiative in the whole history of the world. We think of it here in Canada when we talk about healthcare. We don't think of the debates that go on because healthcare is the responsibility of the provinces, not the federal government. It's like that in most countries. It's like that in Afghanistan. Well, I shouldn't say that in Afghanistan. Certainly, it's that way in Pakistan and in Nigeria. So it's not a question of just going with the federal government. I can remember the first time I went to Nigeria, and we were talking to the federal government about why it was taking so long. This was back around 1986, 87, and the president at the time, of course, was sick, and he was in hospital. He was in France, and I met with the Speaker of the House. And the Speaker of the House said, well, Mr. Williamson, don't tell us. We get the money. We give it out to the state governments, and the state governments give it to the local governments, and there's nothing else we can do. Well, of course, that's the challenges that UNICEF people on the ground, the World Health Organization people on the ground, and the Center for Disease Control people face. It's bringing together all of these areas of government. Also, the differences in approach, all of which is important, all of which would say to be an impossible task, but it's a task that's being achieved. And it's being achieved because of so many organizations that have come together in addition to those five, the five polio partners. Organizations like the Aga Khan, who have contributed greatly in areas of the world where it was difficult. because this was something new, something that was not heard of, something that was in some cases opposed by religions because there was a suspicion that it was birth control. I can remember the first time I went to Nairobi, Kenya. One of the priests there, one of the Catholic priests there, had railed against the national immunization days. The next national immunization day, the Archbishop was on the front page of the newspaper putting the drops in the mouths of the children. And after that, we had very little trouble in Nairobi or in Kenya. We had the same type of problems. Hey, people meaning well thought that immunization is a bad thing, that it can cause other symptoms. All of these challenges have been overcome because of the patient work of the World Health Organization, of UNICEF, the Center for Disease Control. And for that, I want to thank you. I want to thank Canadians particularly. I'm proud, as I said, to be a Canadian, because Canadians, in addition to Bruce Aylward, have played a big part in this. Rotary's contribution, leadership has been with Dr. Bob Scott. He has been the chairman of our International Polio Plus Committee. He's traveled everywhere in the world to work to make this happen. But in the final analysis, it's everyone that's in this room that's participated. Participated whether you gave money to the government for taxes or because of your interest in the places that you've traveled to take the message of polio eradication around the world. And think of it, this is, I believe, the largest public-private healthcare initiative in the whole history of the world. And when it succeeds, it'll be the basis for other successful campaigns. You've laid the groundwork. We're thankful to the Aga Khan for the contribution they've made. Rotary and the Aga Khan have been together in other partnerships. And so I thank all of you for being here, and I congratulate you all.
Thank you very much, Wilf. My name is David Morley. I'm the President and CEO of UNICEF Canada. And I'd like just to take a few minutes to say why we at UNICEF are committed to eradicating polio, are committed to this partnership that's done so much so far. And then, well, I'd like to welcome people afterwards to come and spend some time in the exhibit. We've been going back in history a long time to before Bruce was born, go before when I was born, because the worst outbreak of polio in the terms of percentage of a community attacked in the history of the world took place here, not here in Ottawa, but here in Canada, in Chesterfield Inlet, in Nunavut, in 1949. There were 275 people at risk in that Inuit community. And of that, 50% of them developed clinical polio. 12% of the children became paralyzed. 5% of the children died. Those were the highest numbers ever, and it was here in Canada. And just think of what that terrible, terrible plague must have been like for the people of Chesterfield Inlet. Now, an outbreak on that scale today in Canada is unimaginable. We have managed to eradicate polio from this part of the world thanks in great part to cheap, easily administered polio vaccines and routine immunization. Children, families, and communities here are safe. But we've been hearing and we know that still, despite those incredible strides, the strides that Bruce, that statistic you talk about, 1,000 children a day, 25 years ago, 44 cases so far this entire year. What strides, but nevertheless, in Pakistan, in Nigeria, in Afghanistan, Syria. Some of the poorest and most vulnerable children in the world remain unvaccinated or undervaccinated because they live in places that have become inaccessible by conflicts, or because their communities do not accept the benefits of the vaccine, or because health systems have broken down and immunization is being neglected. Think of those children, because there, the polio virus is still striking. It's transforming children from healthy and active to suffering pain, suffering paralysis, suffering permanent disability. And I think we've been hearing from Wilf and Bruce, they're global leaders in this fight, that as long as there are children who are at that risk, they and UNICEF and our colleagues at UNICEF and many of us here from DFAT, we will not stop until we reach that end, when we have eradicated polio. And the support that we've received from those of you at DFAT and from the government, from the political levels, from all stripes it's a non-partisan issue. It's an issue. It's a human issue. That's why we've been able to see this incredible decrease, and we've continued to see this important contribution by the Government of Canada. I guess we're all doing some memory lane. I'm thinking of being in West Africa at a polio vaccine campaign, and in some of the most remote areas, and the colored fingers of the vaccinated children. But what I also thought was amazing was to see the systems that have been created to supply the vaccines to those remote areas, to make the cold chain work, to distribute those vaccines, to educate the community development work that's involved, to build the support in the community level, all the effort that have gone to making a stronger health system. And when you have that strong health system, it's not only for polio eradication, but it's for other immunization and stronger health systems for women and children. It saves more lives. And this is part of the legacy that's being created by the generosity of Canadians, by the work of DFAT, and certainly for us at UNICEF. In this particular instance of polio, we're very proud to be partners with WHO and with Rotarians. And we're proud too to be Canadians, because the commitment that we heard from the Minister, that we know from the Prime Minister, the commitment to polio and to maternal and newborn child health is remarkable. There's going to be a summit in Toronto in a few weeks now, talking about what next for maternal and child health, and we encourage the Government of Canada that as you consider what will be Muskoka 2 and the continued commitment to maternal and newborn child health, that this investment continue to be made in immunization, including polio, in nutrition, and reaching the hardest to reach children and women. The equity research that we've done at UNICEF shows that a focus on these hardest to reach, going to the forgotten corners of the world, is not only right in principle, it's strategically and financially sound, because it's good practice. When we're able to reach those hardest to reach, we improve all the way along the health system. You'll see some of the results when we have those, when you see the photographs that are out there. Since 2006, the Government of Canada has helped UNICEF in Afghanistan, for example, and has helped us protect 7 million children across the country from polio. Canada is the largest donor to UNICEF's polio program in Afghanistan, and a lead donor to the Global Polio Eradication Initiative. This initiative is the partnership between countries and UNICEF, WHO, and Rotary International, CDC, and others, knows how to finish this job of eradication. Our priorities for accelerating progress towards this goal in 2014 are speeding up our polio outbreak response. It's harnessing polling data to tailor operations to the needs and attitudes of polio-afflicted communities. It means developing sophisticated security analysis to secure access to the hardest to reach areas, packaging other essential interventions alongside polio vaccines, and ensuring vaccine supply continues to meet the needs of all countries. We do it, we all do it, because we believe that no child is too far, and we'll do whatever it takes to reach every child. There will be a chance now to talk, see the pictures. Khalil's going to make us stand someplace so that we talk to people. You don't want to talk to me. You want to talk with, I mean, you do want to talk to Bruce and Wilf, but you don't want to talk to me. You want to talk with Anjuli Kaur. I don't know where you are. There she is, there, who is one of our polio experts who has come from UNICEF in New York, and she will be able to answer many of your questions. And if you ask me anything, I go, Anjuli. So you can just go straight to the source. Thank you all for coming here. It's wonderful to be able to share good news. We're not there. We're getting close to the finish line, and we've got a little ways to go. It'll take hard work. It means we can't drop the ball now. But thank you for coming to think more about this. Wilf, Bruce, thank you so much. A special thanks to my friend Khalil. I'm sure it doesn't take this, but be sure that your new baby gets fully vaccinated. We have next week. That's good. That's good. So thank you for all you do, and for making this space available to us. So please, I invite people to come out. There's some refreshments on the other side of the glass there, and we can talk some more about this. And you can see those pictures out there, which are a testament to the wonderful work that people are doing to make sure that polio will be eradicated. Thank you.